you just had a C-section or know you're going to, then this is your survival guide. These are the exact things that you need to know to have a smoother recovery. No fluff, straight from the nurse's station. Stay tuned. Hey girl, hey, it's your birth bestie, Nurse Rini, and I am back in the Birth Prep Lounge with another video for you. In the Birth Prep Lounge, we prepare you for a hospital-based birth and give you all the information that you need that no one else on the internet does. I have been a labor and delivery, level 3 NICU, postpartum, and antepartum nurse for 17 years, and I have all of the information that you need so that you come out strong on the other side. As you may know, a C-section is major abdominal surgery, and while many women don't plan to have a C-section, it still doesn't change that the C-section rate in the United States is at 32.3%. So it's a pretty sizable amount of women who undergo a C-section. Now, some of these women will know and have a scheduled C-section, and then some of these women will have labor and end up delivering by a C-section. And then others will have a stat or emergency C-section. And all of these look very different in how they are carried out. So I'm going to go over them briefly with you so that we can then talk about how to ace your recovery. First, we are going to touch on a scheduled C-section. This means that the surgery is planned, a date is chosen, and we know that we are going into a controlled environment and a controlled situation. Common reasons for a scheduled C-section could be breech presentation, placenta previa, a repeat C-section, or just your personal choice. Typically with a scheduled C-section, the environment is very calm, everyone is prepared, your pain is usually managed adequately, and your partner or support person is present. Pain control with a scheduled C-section usually looks like you getting a shot of Duramorph, a type of morphine that will help you stay relatively comfortable for even hours after your surgery. Even if the surgery is planned, it's still a major surgery, and recovery is still something you want to stick around and listen out for. The second type of C-section that I want to talk about is the labor turned C-section. This is for those women who maybe have a stalled labor, a non-reassuring fetal heart tracing, or mom's been in labor a lot of days, which is still labor stalling, but she's also just exhausted. So even if she could push the baby out, she may not have the energy to do so. In this case, maybe mom has an epidural placed already, and they would use that epidural line to make sure that she is comfortable for her C-section. This is clutch because this way you get to go into the operating room and you get to stay awake to greet your baby. Hopefully with this type of C-section and pain management, you will have your pain adequately managed, also with Duramorph, the derivative of morphine. This will allow you to have a better transition to the postpartum period, but with a little more pain control. With these mamas, they usually feel frustrated. They feel like their body has betrayed them. But I want to caution you from that train of thought because this is still birth. It's still major surgery, and you did well. The other common type of C-section would be a stat C-section or an urgent or emergent C-section. In this case, people are pulling wires and cables out of the wall and they are running you back to the operating room really quickly, and it's like a team of people descend on you. It's like SWAT. Some of the reasons for a stat C-section would be acute fetal distress, maybe a placental abruption, a cord prolapse, those emergencies that we talk about in the course. Again, this involves the whole team descending on you and rushing you back to the operating room. If you have an epidural, they could dose you and get you comfortable very quickly, but if you don't have an epidural and it's a stat C-section or a crash C-section, then they are going to put you to sleep. And if they put you to sleep, your partner is not usually going to be allowed to stay in the room, or your support person. And usually the pain control is not the same as it would be if you had had an epidural in place already or you a scheduled cesarean section, because they don't usually use Duramorph with a stat C-section. They just put you to sleep. So pain control after a stat C-section without medication on board looks like a PCA pump or patient controlled analgesia, which means you have a continuous line of medication infusing and you have a button that you can hit to give you doses as you need it. But typically patients who get Duramorph during those labor turns cesareans or those planned C-sections have a much more comfortable initial recovery. I'm not going to hold you. A stat C-section can be very traumatizing, okay? So I do advise, if you do have a stat C-section, that you go ahead and have your therapist on the line for post-op day 3, like when you get discharged home. But guys, I'm so excited to bring these recovery cheat codes to you, because no matter what experience you have going into a C-section, all of these cheat codes will be beneficial to you. So let's get started. Recovery cheat code number 1. And this is something that I teach all of my families and my mamas during the postpartum period. Take nice deep breaths. It's important that you do that, because if you don't, you risk having lung collapse, developing pneumonia. So you want to make sure you're taking those nice deep breaths. Now you may be thinking, Rini, why wouldn't I take nice deep breaths? Most times if you're very sore, you don't want to use those muscles that come into play to take those deep breaths. So we really want to make sure that you are going. As much as it hurts, you can do it. You need to do it. You really should do it. Now, your nurse may give you something called an incentive spirometer. And if I can find a picture of one, I will put it up on the screen. And I highly recommend using your incentive spirometer. Now, an incentive spirometer allows you to really engage your lungs in a breathing activity. So if they don't give you one, I would say definitely go ahead and ask for one. So the way to use the incentive spirometer is to use it 10 times per day. And the thing I usually teach my families is watching TV, use it during commercials, right? Throughout the entire commercial break, just use the incentive spirometer, which makes you inhale deeply and then you let it out, okay? And you have a goal to reach. When you're inhaling, the meter will rise and you have to be able to meet that goal. So you have a goal, you have a target, and we have a time frame that will help you be successful in taking those nice deep breaths. You can also use feeding times with your baby to stack your breathing exercises. As long as you have a pattern or a routine that you're following, so that you can make sure that you are getting in those breathing exercises, so we don't set up pneumonia or have a collapsed lung or anything like that from our surgery. Cheat code number 2. You want to make sure that once you are cleared to get out of bed, that you do so. I highly, highly recommend that you take your baby for a walk in the bassinet outside of your bedroom. Usually you're cleared to get out of bed anywhere from 6 to 12 hours after your surgery. Your nurse will definitely let you know. You always want to take your very first steps after surgery with your nurse, not with your partner, not with your support person, with your nurse. Walking is going to be important because it's going to improve blood flow and circulation, digestion, and your bowel function, which we will come back to. And one of the biggest ones is it will reduce your risk for a DVT, or what is also known as a deep vein thrombosis or a blood clot. These are a huge deal. Blood clots can be life-altering or life-ending. So I don't want that to be your story. So make sure that you are getting up and you are walking around as soon as you are able. Start small. You don't have to run track all at once. The first things that you want to be able to do is to, again, take those deep breaths, be relieved of your pain, and turn and sit on the side of the bed. That right there is a lot of movement for someone who just had major abdominal surgery. So I applaud you, even if you can only do just that. Start by walking around your room. Walk around your room, walk to the bathroom back and forth, and see how you feel. And then gradually increase it. Maybe the next day you venture outside your room and walk to the nurse's station. I know I used to tell my patients, hey, I'm going to be at the nurse's station, which is central on the floor. I want to see you walk past me. I want you to wave when you walk past. I want to see that you're up and at 'em and getting out of bed and walking. And another insider tip that I have here is go ahead and get your pain under control. You want to have a plan in place. If you want to go for a walk at noon and it's 10 o'clock now in the morning, I would definitely say reach out to your nurse, have her give you some pain medication at about 11 so that by 12 it's kicked in and you feel comfortable enough to go ahead and take those fruitful first steps. No doubt your body will say, girl, I'm not ready. I'm not ready. I'm not ready. But trust me, moving is healing. Recovery cheat code number 3. Okay, guys, this is a big one, and it's something that I don't see happening in hospitals anymore. And I teach my nursing students to teach this to their patients, but I also teach my mamas how to be successful with this tip right here. You want to splint your incision. What does that mean? Where your incision is, you want to take a pillow and you want to press in and up on the incision to support it while you are moving. I always say do that when you are laughing, if you're crying, if you are walking. You can always splint your incision to make yourself feel better. Splinting your incision will help reduce pain. It will increase your confidence in your ability to walk around and take those deep breaths. And it's going to support the actual incision sites. So one of the things that's not really talked about is that incisions can open up. It's called dehiscence. So where they suture you up can actually start to open. So one of the ways to avoid that is to take some of that pressure from your stomach, pushing or hanging down on the incision, and supporting it with a pillow will help avoid that. I would also recommend high-waisted panties and or an abdominal binder, and ask your doctor about that. But basically it's like a waist trainer, but it helps support your stomach so that it's not just hanging there and pulling on your back and sitting on the incision. It'll help support and bring everything up. Recovery cheat code number 4. Bowel and gas pain can feel like a heart attack. You will either feel it in your chest or you may feel it in your shoulder blades. Either way, it's pretty terrible. And I never understood quite how bad it was until I experienced it for myself. I remember being in my bed at night, wondering if I was gonna make it to the morning and am I having a heart attack? Should I go to the ER? Or is this just gas from the beans I ate? So definitely you want to make sure that you manage this. The reason that your bowels are in such a funky way is one, partly due to anesthesia, especially if you've had general anesthesia. And also two, when you have major abdominal surgery, that's where your bowels are. So sometimes they can be rooting around in there, moving things out the way, and it can impact how you experience gas after you've had your baby. So some of the ways to combat this gas pain will be some of the things that we've already reviewed. Those nice deep breaths, getting up and walking as soon as you can. There is a medication called simethicone that they will likely give you while you're in the hospital. Keep taking that. One of the things that I always gave to my patients, I always highly recommend it, is a suppository. Don't, no. Stay here, friend. The thing about suppositories is one, they don't hurt going in. I can talk more about why that is, later if you want me to, just leave it in the comments. But the other thing is that even if you don't have to poo, it will help you blow out that air. And when I tell you, if you've had gas before, it can have your stomach sitting out there like you're pregnant when you're not pregnant, okay? And so when you are able to expel that air from your abdomen, you feel so much better in your stomach, but also in your chest. One of the things that I also highly recommend is don't go too long without having a bowel movement. Now, if you had a C-section, you're likely going to be on narcotics for pain management and pain relief. Those can add to your constipation, along with iron that's going to be in your prenatal vitamin, or it's going to be given to you as an additional supplement if you are anemic. So as soon as you are able, you want to go ahead and get rid of those pain meds so that you can start to have more regular bowel movements. You also want to make sure you're taking your stool softener as recommended by your doctor or midwife. But again, don't go too long without having a bowel movement. Making sure that you're walking around and making sure that you're getting a lot of water in will help that gas pain and hopefully help you to have a bowel movement. Recovery cheat code number 7. This is also huge. They're all huge. This is why I'm sharing them with you. You want to make sure that you are managing your pain. Don't try to be a hero. Take your pain medication, because if you don't take your pain medication and you're uncomfortable, you're not going to do any of these things that I've talked about. And these things are your roadmap to a speedy recovery. So I told you I've worked all over, right, in a major metropolitan area. And typically what the doctors are ordering for your pain management is going to be the same. It's usually Advil or ibuprofen, Tylenol, and or a narcotic like Oxy. Those are the three things that they're going to usually offer you for pain relief from your C-section. Take your medication, because if you're in pain, again, you're not going to want to move. And moving is going to be the key to your recovery. But you know what else causes pain? An infection. If you get an infection along your cesarean section scar, those can be particularly uncomfortable. So as you get further and further out from your C-section date, you should feel less and less pain. So if you notice that you're feeling more pain at that area, then definitely you want to call your doctor and let them know immediately. So infections at the incision site look like redness, which is inflammation. It can be extremely sore. It can be oozing something green or yellow, or even blood. It could smell bad. So these are things that you definitely want to keep an eye out on. And if your incision is causing you increased pain instead of getting better over time, then you want to definitely let your doctor know. I have seen patients come back to the ER because their incision area is infected, and I don't want that for you. This is what our timeline looks like for recovery. Days 1 through 3, you are just coming out of surgery. You are learning about what it feels to have major abdominal surgery and have to take care of a person, a little baby, right? But you're also learning how to take care of yourself. So you're going to hydrate, you're going to get out of bed and start walking, baby steps, and you're going to make sure that you are taking those deep breaths and managing your pain. Week 1, I highly recommend that you do some extended walks at your local park or around your neighborhood. Don't do any more than your body actually tells you to do, right? But do start to increase as time goes on so that you can heal fully and extensively. At this point, your pain should be improving. But like I said before, if your pain is not improving, then you definitely want to let your doctor or midwife know. Weeks 2 through 6, you will have seen the doctor by then, because they usually want to see C-sections back within 2 weeks to check on that incisional scar if you don't call them before then. You want to continue to focus on hydrating, drinking that water, a balanced, healthy diet, and gentle mobility. You can pick up the pace with your walking, or you can even extend your walking times. The thing is this, everyone's recovery looks different. So do not go out there comparing yourself to these women on TikTok. I'm telling you, it looks different for everyone, and it's a major surgery, and you are in it to win it. Your C-section may have been planned, unexpected, or emergent, but recovery success comes down to these 4 things: breathe, walk, support, and poop. Make sure you focus on these things every day. You'll feel stronger, more in control of your body sooner. So make sure you save this video to your postpartum checklist, refer back to it after you've had your baby or before you go in to have your baby. And if you're pregnant, share it with your partner so that they can best support you, and share it with other pregnant women that you know may be having a C-section, or you just feel like this is useful information. This is your recovery roadmap, and you are going to win. All right, guys, this is it for the Birth Prep Lounge today. Make sure you like, comment, share, and follow for more, and I will see you in the next video. Bye.
Now where do we go from here? Tell me.